Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today we have in with us Miss Rhiannon Gill, was in a car accident about a year ago, okay? And she had some severe spinal injuries to the neck and to the lumbar spine, in which she had to undergo surgery procedures. If you can zoom in on this, she had disc replacement done at C5 and C6, and then disc replacement also at L4, L5, and some hardware put in at the L5, S1 junction. Now, Rhiannon's had great results with the cervical procedure. She was having problems with neck pain, migraine headaches, radiculopathy going down the arm. That has improved from the cervical surgery. Lumbar spine's a little bit different story. She still experiences pain, localized pain from time to time, about the L5, S1 area. No radiculopathy going down the legs, that's been stabilized. However, she had a slip and fall over the weekend, right? And suffered some compressive stress to that lower back. So when we did an exam, she has some palpable tenderness in there and inflammation. So she's here today to see if she's a candidate for chiropractic care and what we do, and see if the adjustments that we do here can help. And after a close examination of her x-rays and talking about her history, I have determined that she is cleared for an adjustment procedure, including the ring dinger. And it's a matter of, just like with any treatment, Rhiannon, we're gonna do some adjustments and see your reaction. Just like when people, take a medication, you take the medicine, see how you respond. Same thing with the adjustments. We're gonna do some adjustments and see how you react to these types of procedures. Now, the takeaway here for those people who have had spinal surgeries before, if these surgeries are 9-10 months out, right? The bone's solid and the joints have stabilized. Chiropractic care, most people's apprehensiveness to getting chiropractic care is fear. They fear the sound, the popping. They think, oh my God, you're gonna break my neck, you're gonna break my spine. The takeaway here is that I want you guys to see in YouTube land that this patient has undergone some major spinal procedures already, and she's still safe to be adjusted. And that should be a testament to how safe and effective chiropractic care is. So there's a tremendous amount of misinformation out there about chiropractic, and what I want people to realize is it's so safe, it's so effective, that even when you've undergone procedures such as disc replacement surgery or fusions, that it's still safe to do and people can still get a wonderful result. So with that message being, I'm trying to be as clear about that as I can, we're gonna get started on your adjustment. You have any questions for me about this before we get started?
No, I think I'm good to go.
All right, well, let's go. I want you to go face down right here for me, Rhiannon. We're going to start with the biophysics table. Head here. Okay. Let's scoot you down a little bit. Okay, now we're going to look at Rhiannon's leg length, and she's a little short on the right. Let your knees bend, Rhiannon. Good flexibility in the quads. You feel any back pain there when we do this?
No.
Any tightness? Okay, good. She's got good range of motion. She's short and she stays short. So there's a little bit of subluxation. Now, I know because of scar tissue and whatnot, chiropractors, you need to make a determination of the inflammation that you're feeling in a spinal joint. Is it coming from scar tissue? Is it coming from incision, of the prior procedure? Or is it something deeper in the disc? And the texture of the discs in the joint, it's a matter of experience and whatnot in determining where that's coming from, where that pain and tenderness and inflammation is arising from. Differentiating between joint dysfunction and scar tissue that's secondary to a surgical procedure. Okay, so we're gonna start by releasing the pelvis, Rhiannon, then we're gonna work up through the spine into the neck, okay? You can feel the table kick up here. We're going to start on this right SI joint. Good. Great, good release. Chin up for me a little bit. Good release. Let the shoulders roll forward. That's it. Big push. Great. Okay, we'll go back down. Now that slip and fall, you did this, right? You compressed your spine. All right, very good. Now, she's even, okay? Bend the knees for me. Even and stays even. You're good. I see the bruising from the fall too. You did good.
Yes, I did.
Okay, let's work that neck a little bit. See, we're able to use specific contacts and work above and below those disc replacements. Very simple, very gently, very easy, and get a change. All right, go ahead and roll over on your back. So far, so good?
Yeah.
All right, scoot you down just a little bit. Okay, that's it, bring it to the tummy. Now we're gonna work on bringing it on your head forward posture. We'll work on bringing that head back over the shoulders. Okay, let's take this arm, spread them out, put them in a T. And feel the chest piece kick up. Okay, hands on the tummy. All right, now we're gonna decompress hip and knee, okay? That leg dangle for me. Very good. Should have felt that release quite a few spots.
Yeah.
Same thing here. There we go. Very good. Okay. Hold up. Spin this around. All right, how we feeling?
So far, so good.
Okay, let that arm dangle here. It's there. Extremities got good range of motion, radial head, give a good cavitation there. Now again, the idea behind adjusting all these joints is to bombard your cerebellum with neurostimulation, okay? Every time we stretch a joint out like that, we're firing off nerve endings that help reprogram your brain to tell your joints to adopt this new configuration of movement, okay? It's the neurology behind the adjustment. All right, so far so good. Now we're gonna switch over and do your decompression. All right, for this procedure, we're gonna have you sit right here, Rhiannon. Sit here and lay with your head in this direction here. Okay, there you go now. All right, now for this, we want to put the spine in a neutral position. All right, we achieve that position by elevating your legs. So keep your legs very still and let the table do the work, okay? Now you've seen some videos of this done, huh? Okay. You kind of know what to expect. Let's put this up down a little bit. Okay, there we go. Get those legs a little bit higher. All right. Now, it's going to be a tight squeeze. Big breakfast this morning?
No breakfast.
No breakfast. That's for the best. Squeeze the boot out of you. All right, just let that pin sink in the side. There we go. Here, press the hands. That's it. Look at that. Good reflexes. All right, Rand. Important things, just stay relaxed, okay? Stay relaxed. Want to keep your back teeth touching. Tongue in the center of your palate so you don't bite it. Breathe through the nose and wiggle your third ear.
Ow!
Breathe, breathe, breathe. Now, let's see. Everything intact? You felt that go all the way down? You did good. Never experienced anything like that, huh? Okay. You tolerated it well. Wiggle your toes for the YouTube audience. Yeah. See? Everything's still good. Where'd you feel that release the most? Yeah, lower. Right where you had the compressive injury from your slip and fall. Alrighty, ma'am. We're gonna work up a cervical here. Okay, good. Good range of motion there. Got another release there. All right, let's lower those legs. Okay. Let's sit up for me. Spin that around. Hop down, walk around. She survived. Yeah, yeah. It's a big stimulation. Look,
Yeah.
it's a real big stimulation. Putting that vector of force through the spine, never had it before, so it'll get it. It'll get it.
For sure.
But the idea is decompressing those joints, right? Gravity compresses you down, and we just undid what gravity does to you 24/7. All right, good deal. This is good. Double checking your atlas here. Checking number 2. You're good, man. All right, low back pain that you walked in with. Ooh,
I don't know that I can tell yet. I'm still seeing spots.
still seeing spots, yep.
No, I mean, it feels good. I'm
Okay.
good.
All right, yeah, feels good.
Yeah.
You feel a release down there. Now you
Definitely.
may be sore. Expect some soreness because we made that joint do something it's never done before. Made those joints do something it's never done. You manage that with crushed ice in a Ziploc bag, put it on the sore spot, 20, 30 minutes. Stretch and rest, okay? Drink
Sounds
plenty
good.
of fluids, and you're gonna repeat this till your symptoms clear out. Usually 3 or 4 adjustments and you'll be good.
Thank you.
All right, any questions from me?
No, I think I'm good.
Okay, see, she survived. She survived, okay? So for those people who have had spinal surgeries, make an appointment, schedule a consultation. We'll check you out, see if you get cleared for chiropractic treatment. Not everybody's a candidate for this stuff, but the vast majority of people are. And this should prove to y'all how safe and effective these adjustments are, even though they may look scary. Here's a young woman with all kind of hardware in her back, and she tolerated it fine. It was intense, yes, but we're here to make changes. We're not here to play games, all right? This isn't just done for YouTube clicks. Chiropractic adjustments are serious procedures used to help serious healthcare problems. So if you like this material, think it can help somebody, please like, subscribe, and share the video. Hit the bell for notifications. This is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.